My name is Dr. Brian Smith. I'm Chief of Surgery and General Surgeon here at Physicians Regional. I specialize in robotic hernia repair surgery and also laparoscopic gallbladder and anti-reflux surgery. Gallstones are very common, although a lot of the patients who have gallstones won't have any symptoms from them. For the people who do, however, once it starts, it usually continues and gets worse over time. Most of the time, patients who know they have problems with the gallbladder will start with some epigastric, so some upper mid-abdominal pain or right upper quadrant, right-sided pain, kind of just below the ribs. And then this sometimes radiates around the right flank, and then will also go even to the shoulder. It usually starts about 30 minutes after eating food, especially fatty foods, and can be associated with some other symptoms like nausea, vomiting, feeling sweaty, bloated, and even loose stools. If this continues, then it's time to get the gallbladder checked, which is usually done with an ultrasound. There are some other studies which can be useful in slightly more confusing cases. For people who have ongoing pain and gallstones, then the recommendation is usually that the gallbladder come out. The procedure is pretty straightforward, and most people do fine without the gallbladder. In general, the gallbladder's role as an organ is to store and concentrate bile, which is made in the liver. And then when you eat fatty food, there's a signal that triggers the gallbladder to contract. It pushes the bile out and helps you to digest and absorb the fat in the food that you eat. That's why if you eat the fatty food and you have stones, it pushes against the stones and it causes the pain. If you're lucky, the stone gets out of the way and things get back to normal, but if it never clears, then it can lead to other problems such as cholecystitis, where the gallbladder actually becomes thick and inflamed and sometimes infected. You can also push stones out of the gallbladder into the bile duct, which can block the bile duct and cause jaundice, a backup of the liver enzymes. And because the pancreatic duct drains through there, it can also cause pancreatitis in really severe cases. In those cases, that duct has to be cleared through another procedure called an ERCP before you can have the gallbladder removed. For people who just can have the gallbladder removed, it's generally an outpatient laparoscopic surgery unless you're admitted because of infection. It usually takes a little bit less than an hour with 3 or 4 small little incisions of the abdominal wall. Most people do really well with it and have just some mild discomfort, mostly around the belly button, also sometimes on the right side of the abdomen for about 3 days. Some people also will feel kind of bloated and have some shoulder pain from the gas that we blow in during the laparoscopy. And getting up and walking helps to get rid of that and speeds the recovery. After the gallbladder's out, you can return to a normal diet, but some people will notice that some fatty or greasy foods will upset their stomach, especially for the first few months, and about 90% of the time that goes away after about 3 months for the patients who do have it. Patients can return to an active lifestyle pretty quickly after the surgery. Walking is definitely encouraged. As far as golf and tennis and lifting, we usually recommend about a week to 2 weeks just to allow the incisions to heal, especially the one at the belly button.